Today, the New South Wales government defends its handling of the Ruby Princess cruise ship, despite knowing passengers were ill before it docked in Sydney.
We need to make sure that we are temperate and supportive of all of these senior staff who are making the most difficult of decisions.
Also ahead, backpackers helping farmers and essential industries to have visas extended to stay working through the coronavirus crisis. New York's deadliest day, COVID-19 kills more than 560 people. And the UK's death toll continues to climb while Spain passes Italy's case count. Hello and welcome to ABC News. I'm Miriam Corowa. Let's take a look at the latest coronavirus figures in Australia. The number of confirmed cases around the country is sitting at 5,499, with the death toll at 28. New South Wales remains the state with the highest number of cases, rising by 104 last night to 2,493. 27 new cases have been reported in Queensland and 6 more have been confirmed in Tasmania. Although cases continue to rise in every state, the data shows a downward trend in the rate of infections. Passengers who sailed on the Ruby Princess cruise ship are taking legal action against Carnival Cruises over the coronavirus outbreak on board. The vessel is linked to hundreds of COVID-19 cases and at least half a dozen deaths. Let's cross live now to our reporter, Riley Heyman in Sydney. So, Riley, New South Wales Health is defending its handling of this saga.
That's exactly right. We just heard in the last hour from the New South Wales Health Minister, Brad Hazzard, and he has talked us through the handling of this situation and how everything unfolded. There were 2,700 passengers that disembarked the Ruby Princess cruise ship some weeks ago, and that was despite health officials knowing that there were people on board the ship that did have flu-like symptoms. Now, we obviously heard following that whole situation that there have been 7 people who have died from that cruise ship as a result of contracting coronavirus, and more than 600 people from that cruise ship have had confirmed cases of coronavirus. So the New South Wales Health Minister, Brad Hazzard, said that there was a team of around 4 medical professionals in his group of employees that made the decision to make sure that people were able to disembark on that day. Here's what he had to say.
The experts who made the decision, were the best in the world. And the appropriate thing at this point is for the investigation to continue. But I'll make this point too. Each of the staff of the Chief Health Officer that made the decision made it to the best of their ability. And those people are experts in their fields.
So you heard there from Minister Brad Hazzard, and obviously this situation has also brought up a investigation which is being headed by the New South Wales Police Commissioner Mick Fuller, and he's going to be looking into exactly what unfolded and how these people were let off this ship.
Investigations continue there regarding the Ruby Princess cruise ship. What's happening regarding the other cruise ships along the New South Wales coastline?
Well, as you can see behind me, there are 2 ships that are currently in Sydney Harbour at the moment. We understand that there are also a number of other ships offshore from Sydney that will be receiving humanitarian relief from the state government, and they will then be asked to leave the Australian waters and head back to their port of origin. The New South Wales Police Commissioner Mick Fuller has said that he is happy and willing to give this humanitarian support to these ships, most of which have only crew on board, in order for them to leave New South Wales waters, and that is because he does not want more people coming ashore and potentially spreading this virus any further.
Our reporter Ronnie Heyman there in Sydney. Qantas and Virgin are arranging flights to help Australians stranded overseas to get home. Many people have struggled to find a way back because airlines have reduced their operations as a result of coronavirus. The federal government has reached a deal with Qantas and Virgin so that flights will now be offered from 4 major international cities. Political reporter Stephanie Boris joins us now from Parliament House. So Stephanie, just run through the details of this new plan, which is aiming, of course, to get those stranded Australians home.
Well, over the next 4 weeks, Qantas and Virgin will be flying their planes to 4 international cities to bring Australians stranded overseas home. These cities are Los Angeles, London, Hong Kong and Auckland. Now, the deal that's been reached between Virgin Australia, Qantas and the federal government is that these planes will go overseas. Obviously, they'll have no passengers, so the federal government will cover the cost of that. But passengers will be required to pay for their ticket home. There has been an assurance given that the cost will be reasonable and not what we saw in Peru, where a chartered flight there cost passengers more than $5,000 to get back to Australia. The intention also is when those planes fly to those international cities, they'll be taking exporters' goods. So it means that Australian producers here will still be able to get their goods and produce overseas. Now, Qantas and Virgin will have the details on their website. We're aware with Qantas, their first flights will start next Thursday. They're aiming to have 2 flights leaving every week, and every passenger is being urged to book directly with Qantas and Virgin to ensure that there's no confusion with the process going on.
Now, Stephanie, back home, in an attempt to fill jobs in regional areas, some changes are being made to the working holiday visa, more commonly known as the backpacker visa. Just what will those changes entail?
So there's about 118,000 people on this visa at the moment in Australia, and there are a few changes being made to the rules around this visa. First of all, if backpackers are working in critical areas such as agriculture, health or aged care, they will have their visa extended by up to 12 months. This is to ensure that there are adequate people to fill these jobs. On top of that, at the moment, those working on a farm can only stay with an employer for 6 months, but that is being extended to allow people to stay there for longer and to be able to pick that produce. Now, the Agriculture Minister, David Littleproud, has been out this morning. He said the whole reason for changing the rules is to ensure that there are enough workers to pick the produce that needs to be sent to supermarkets across Australia.
This is a critical time for our food security in our nation, but also continuing to keep our export markets open. This is an important step. We've listened to farmers, but we've also ensured that we're doing this in a responsible way that meets health requirements. Yesterday, National Cabinet made it very clear that those backpackers, those visa holders under these 3 cohorts will not be able to start work unless they have self-isolated for 14 days. There is a duty of responsibility of farmers, of industry and these visa holders to ensure they live up to that as they move from region to region and state to state.
Now, on top of that, the government today has also confirmed that a number of people in Australia from Pacific nations that are on visas as well, if they are continuing to work, their visas will also be extended by up to 12 months, once again to ensure that there are people in those jobs in regional areas.
And Stephanie, also we understand that an anti-malarial drug will be soon offered to patients here in Australia. What's involved with that?
So there's a number of trials going on across the world at the moment to see if this particular anti-malarial drug can help treat coronavirus. And the Federal Health Minister, Greg Hunt, this morning confirming that an international company will send out 20,000 doses of this anti-malarial drug to Australia. They will be given directly to doctors, and patients in hospital will potentially have access to this drug. So it will only be issued to those that have tested positive to coronavirus.
Political reporter Stephanie Boris bringing us up to date there from Parliament House in Canberra. Let's go now to Melbourne, where Victorian health authorities are giving an update on coronavirus efforts in the state.
People understand that there are significant penalties involved in ignoring these restrictions. So as part of the police checks, 391 of these checks were on return travellers. And unfortunately 99 people were not at home. So 99 people out of the 391 return travellers were found not to be at home. Now that's incredibly disappointing. Those individuals are putting their fellow Victorians at risk. They are putting themselves and other members of the community at risk, and it's really important that they understand that since last Sunday we've now been quarantining return travellers in hotels, but for those people who returned prior to the start of those changes, they are still required to self-quarantine for the full 14 days, no exceptions, so they need to be staying at home. Police have also checked 103 businesses, 62 populous places and 50 restricted, that is non-essential businesses and services. As part of this, Victoria Police issued 25 fines to people overnight for not complying with the stage 3 restrictions, taking it to a total now of 64 and taking up the total of the number of checks that Victoria Police have conducted to 12,541. So I thank them very much for the important work that they are doing. Look, I think you would be well aware that the Victorian Government has been working now for a considerable period of time to prepare us for the peak of the pandemic. We have made close to $2 billion worth of investment to prepare our health system. But one key part of this work has been the dedicated contact tracing team that does the important work, the detective work of tracking down everyone who is diagnosed with COVID-19 and interviewing them and making sure that all their close contacts are followed through and that those individuals get the advice that they need to stay at home. So I'm very pleased to inform you that since we have been responding to COVID-19, that contact tracing team in the department's public health team has gone from 57 to now being a 1,000 strong team of individuals. This includes epidemiologists, public health clinicians, logistics, phone operators and data entry staff. And I take this opportunity to thank them for the incredibly important work led by Annalise, who will speak to you shortly about the important work that they're doing. And I thank Annalise for her important work, but to each and every one of those 1,000 individuals, they are doing really important work, making sure that we can track down those close contacts and make sure that they get the appropriate advice that they need about how they can keep themselves safe and also other members of the community safe. As part of this close contact tracing, essentially what this means is that there are interviews that are conducted via telephone, and those individuals will be asked, where have you been? When did you develop those symptoms? Where have you been, whether it's been at work, whether it's been to the local supermarket, whether it's been having a cup of coffee with friends somewhere. They'll be asked all of those questions about how long they spent at all of those locations and who they were with, so that all of those close contacts can be followed up. And it really relates to anyone who's been in close contact within a 1.5 metre space for more than 15 minutes that we are interested in, because they are potentially people who may have been exposed to COVID-19. And Annalise, of course, will explain to you in further detail how the contact tracing works. You might recall that I recently spoke about how we've also introduced a new electronic messaging system so that all close contacts are able to be sent a daily message to make sure that they can confirm that they are in fact complying with their quarantine requirements. Also checking in with them to ask them if they've developed any symptoms of COVID-19. So the 1,000 strong public health team, the contact tracing team, is doing incredibly important work. They are saving lives through the work that they are doing in following through all close contacts related to a diagnosed case of COVID-19, and I thank them for the important work that they are doing. I'll hand over now to Annalise, who will just talk you through a little bit more detail the contact tracing process, and then we're very happy, of course, to take your questions.
Thank you very much, Minister. And I would like to echo Minister Makakos's sentiments to thank all of the people who are doing this very important work, in particular the people who've been doing it from the very beginning and who have, over the last number of weeks, been sharing their skills and their experience and their expertise with a really large number of people who've come in from a wide variety of agencies and areas. And to that end, I'd also like to thank all of the agencies and people who've volunteered their own time or their staff's time to come in and help us with this really important work. And we've had people from universities, from industry, from private businesses, from all sorts of places to come in and build up this team and spread the load amongst a really wide range of people. Very briefly, how contact tracing works. It's a part of a very large web of information gathering systems that is around cases and contacts of COVID-19, and it starts from the time when a clinician diagnoses a case, and that result is notified into the department. It is verified with the laboratories. A patient is then undertakes a fairly comprehensive interview with one of our contact tracing team who does all of the things that Minister Makakos discussed. All of those locations where they may have either acquired the illness or may have exposed other people to are entered into databases. All of the potential people that they've been in contact with, particularly close contact with, are recorded and then further contacted to notify them that they're a close contact of a case. And then we continue to follow up the cases on a very regular basis, and we continue to follow up the close contacts to monitor whether they develop symptoms and become cases. And that enables us to link any new cases with a known existing case, and it enables us to monitor how well Victorians are doing in terms of the advice that's been given about staying home if you become at all unwell. And the good news is that advice does seem to be really being followed, because we can see in the data that the amount of time between when people developed symptoms and when they went into isolation in their home has really dropped over the last few weeks. So that's fantastic news. The other things that these teams do is that they then keep track of all of these cases, and every time we have a new case, they see if there's any known way of linking it to other cases, or if they have zero known links to other cases. That's when they become one of these community transmissions that we talk about, which isn't clearly linked to a known case and isn't part of a known cluster or outbreak. So I might leave it at that for the moment and take any questions that anybody has.
How definitive does the link have to be before it's not labelled as community transmission?
That's a really good question. And so at the moment, if someone is not either linked to overseas travel or a known notified case, then they get designated as community transmission. At some point further down in the outbreak, it may become obvious where the intermittent person was, and they may move to being a linked case to a known importation. But at the moment, if we don't have a case on record who we can clearly link them to, they become a community transmission.
How do you get tested if you've got through community transmission, if you haven't been in contact with someone who's got it, or you haven't returned from overseas? How do you actually then get tested?
So at the moment, the testing criteria does include those links. There's also expanded criteria for hospitalised patients, and as we announced last week, there's expanded criteria for front-facing workers, aged care workers and healthcare workers, and we're reviewing that criteria daily at the moment.
So we're seeing a lot more people coming from those healthcare workers or those frontline workers?
So I wouldn't say we're seeing a lot more people, but we are using what is happening in the community in terms of people home quarantining after travel and home quarantining when they're contacts, to ensure that the people who do have remaining links in with the community, who are still unable to really lock themselves down in their home because of the important work they're doing for our community, and the vulnerable people who they might be interacting with, that is a place where there is potentially risk that the current directions to stay home is unable to mitigate.
That's Dr Annalise Van Diemen, Deputy Chief Health Officer for Victoria, and also the Victorian Health Minister Jenny Mikakos earlier. And the death toll for Victoria now stands at 8 people. A woman aged in her 70s has died in Victoria overnight. New cases confirmed in Victoria have risen by 30. Tasmania has recorded 6 new cases overnight to our regional hospital staff in the northwest region. The state government has announced an investigation into the situation and is urging people to stay at home.
As a government, our first priority is to keep Tasmanians safe and secure and to slow the spread of coronavirus. With 6 new cases overnight, we cannot afford for 1 second to be complacent. We must continue to do everything we can to protect ourselves, our loved ones and our community. This means staying at home, because staying at home, we will save lives. And while the Minister and Dr McEwen will have more details on recent cases, which brings our tally in Tasmania to 80 positive coronavirus cases, I would like to say this. To the Northwest community, who will no doubt have concerns after hearing 2 of its Northwest Regional Hospital staff have tested positive, there is an immediate investigation underway. We have said in Tasmania that aggressive tracing of cases is a significant focus and our greatest chance of identifying sources, putting in place the right protection measures and limiting the spread. This is an absolute priority.
5 of the cases are women and 1 is a man. 2 are from southern Tasmania, 2 are from northern Tasmania and 2 are from the northwest. 2 are aged in their 20s, 1 is in their 30s, 1 is in their 50s, 1 is in their 60s and 1 is in their 70s.
Queensland has recorded 27 new confirmed cases of COVID-19 overnight, bringing the state's total to 900. Queensland Health Minister Stephen Miles says contact tracing is underway for the latest infections.
Overnight, we confirmed 27 positive cases of COVID-19 in Queensland, bringing our total to 900. We've now done more than 56,000 tests. Just 56 of our patients are in hospital. Of those, 6 are in ICU ventilated and 2 further patients are in intensive care, and of course we are taking great care of all of them. All of the rest are being cared for in the community. Last Saturday, when I was here, it's important to remember that the day-to-day results are going to move around a lot, so we need to look at the trends. Last Saturday, when I was here, the week before, we had seen 380 positive results. In the last week to today, we've seen just 276. So we're trending down in terms of the number of positive results. And that is because of the effectiveness of the measures we've put in place. The closing of our international and now domestic borders, the restrictions on social distancing, requiring people to not leave their homes unless it is essential, on top of the incredible effort of our health staff who are testing so many people, who are contact tracing anyone who's been in contact with anyone who is a positive case and urging them to self-quarantine. All of those measures together are helping, and we have to keep it up. If we can keep it up, we will delay the spread of this terrible virus. We will give our doctors and nurses, health professionals and their support staff the best possible chance to save more lives. And that is precisely what we are doing here in Queensland.
In the US, New York has suffered its deadliest day since the outbreak began, increasing by more than 560. Close to 3,000 people have died in the state and more than 100,000 have been infected. Governor Andrew Cuomo says more people will die from a lack of emergency equipment, including ventilators, unless unused materials are redistributed to the state.
I'm not going to be in a position where people are dying and we have several hundred ventilators in our own state somewhere else. I'm not going to let people die because we didn't redistribute ventilators.
Across Europe, the daily death tolls paint a sobering picture. Spain recorded another 932 deaths, although that was slightly down on the day before. Italy saw an extra 766 deaths, taking the toll to over 14,500. The UK recorded its worst daily death count of 684. Buckingham Palace has announced the Queen will broadcast a special address on the crisis tomorrow. Here's Europe correspondent Samantha Hawley.
Here in the UK, the death toll keeps rising. It's now over 3,000, with the highest toll yet of 684 being recorded in the last 24 hours. Boris Johnson still has symptoms of COVID-19, including a temperature, and is still working from home. But on social media, he sent a message to the nation to tell people to stay out of the parks and off the streets on the weekend, when the weather is expected to get much warmer.
I just want to say one crucial thing, one quick thing to everybody thinking about this weekend and what may be some fine weather, because I reckon a lot of people will be starting to think that this is all going on for quite a long time, and they'd rather be getting out there, and particularly if you've got kids in the household, everybody may be getting a bit stir crazy, and there may be just a temptation to get out there, hang out, and start to break the regulations. And I just urge you not to do that. Please, please stick with the guidance now.
A convention centre in East London that's been converted into a hospital is now open. At its capacity, the Nightingale Hospital can hold up to 4,000 coronavirus patients and was built in less than 2 weeks with the help of the military. It received a royal opening with a difference and from a distance.
Now, I was one of the lucky ones to have COVID-19 relatively mildly. And if I may say so, I'm so glad to see the Secretary of State has also recovered. But for some, it will be a much harder journey. I am therefore so relieved that everyone can now have the reassurance that they will receive all the necessary technical care they may need and every chance to return to a normal life. This hospital, therefore, offers us an intensely practical message of hope for those who will need it most at this time of national suffering.
The UK is expected to reach the peak of the virus on Easter Sunday. Buckingham Palace has announced the Queen will address the nation this Sunday from Windsor Castle.
Now, a quick check of the weather in the capitals for today. A shower for Brisbane, cloud clearing in Sydney. Showers for Canberra, Melbourne, Hobart and Adelaide. Mostly sunny in Perth and a possible storm for Darwin. That's the latest from ABC News. I'm Miriam Corowa. Thank you for your company.